public hearing on LD 1162, an act to ensure safe drinking water for Maine families, presented by Representative Gattini. Welcome.
Thank you. It's good to be here, Senator.
We see you here so rarely.
Senator Brakey, colleagues on the Joint Standing Committee on Health and Human Services, I am Drew Gattini. I represent District 34, which is part of the City of Westbrook, and I'm here today to present LD 1162, an act to ensure safe drinking water for Maine families. This bill is part of an effort to tackle a growing public health crisis in Maine, a crisis that threatens something many of us take for granted, the right of Mainers to safe, clean drinking water. I hope we all agree that everyone has the right to drink water that is clean, safe, and free from poisons. Yet here in Maine, we have a long way to go to ensure that families have access to water that is free from toxic chemicals like arsenic or radon. That's because Maine faces a unique challenge when it comes to drinking water. Half of all Mainers drink from private wells, and private wells are not subject to any of the same safety oversight as public water systems. Much of Maine is situated on top of bedrock, and dangerous chemicals like arsenic, radon, fluoride, and uranium leach into our groundwater. 1 in 10 wells in Maine contain a level of arsenic that is above the safety threshold set by the US EPA. And many of our towns are hotspots, where nearly half of all wells contain unsafe arsenic levels. Some wells contain 30 to 50 times the safety threshold, levels that are found to cause skin, bladder, and lung cancers. In spite of all these clear dangers, right now, less than half of all Mainers who rely on private well water are getting their water tested for arsenic and other dangerous chemicals. This means that vulnerable populations, like pregnant women and children, are routinely exposed to chemicals that we know can cause learning disabilities, birth defects, and cancer. For those families who do test their wells and find out that their water is unsafe to drink, that it contains dangerous levels of arsenic, radon, and other chemicals, many are unable to afford the expensive household filtration systems that can cost thousands of dollars to purchase and install. As legislators, we can't tolerate this situation, and I hope we can take immediate action. LD 1162 will make Mainers, including children and pregnant women, safer by significantly increasing the number of families who test their private well water. This bill will provide the Maine CDC with resources to do outreach and education so that everyone will know the importance of testing private well water, and will make sure our state's water testing website has clear instructions for getting private wells tested. The bill will also ensure that new wells are tested when they are drilled, and that landlords share results of their water tests with tenants. The second goal of LD 1162 is to make sure families are protected from poisonous chemicals and can afford home treatment systems for their contaminated well water. The bill creates a home repair fund for low-income families to help them treat their wells. I believe that now is the time to take action to ensure our kids and future generations have access to safe drinking water. I hope this committee will give LD 1162 a strong ought-to-pass vote. I'd be happy to answer any questions from the committee.
Representative Vashon.
Is there a fiscal note on this?
I haven't gotten information back from the OFPR yet, but this is funded by a fee on water tests, and also a $5 fee on water tests, and also a percentage of 3% on new filtration systems as they're implemented.
Okay, so once they get the results of the test, that's where the real cost comes in. So
if there's remediation efforts, so this bill creates a fund that will provide help to people that need support if they're found to be high levels of toxic chemicals in the water.
thank you.
Representative Malaby.
Thank you, Mr. Chairman. Thank you, Representative, for bringing this forward. You said that it seemed that we had excessively high incidence of arsenic.
Yep.
In terms of the allowable, the safety level, if you will. Has that level recently been changed?
I believe it actually has been changed. I think there are people that are coming up behind me that can give you more specifics on that. But yeah, I think the percentage that's considered to be acceptable has definitely changed.
And I could not discern from this who would do the testing. We have private companies that do testing. Are you saying that this water testing must all be done through the state?
No, it would be done by private companies, but there'd be a $5 assessment on those tests that would then go into a fund maintained by the CDC.
Okay. And the 3% charge is for a remediation system? Or,
It's the fund remediation system.
Okay. If somebody were to
Yep.
just put in a sediment filter,
Correct.
would that be subject to same?
I believe so.
Thank you.
Thank you.
Seeing no additional questions, thank you very much, Representative.
Thank you.
All right. Are there any legislative co-sponsors who wish to speak to this bill? Welcome.
Good afternoon, Senator Brakey, Representative Kateen, and members of the Joint Standing Committee on Health and Human Services. My name is Gary Hilliard. I represent House District 76, and I am testifying in support of 1162, an act to ensure safe drinking water for Maine families. I am a co-sponsor of LD 1162 and certainly support the comments made by Representative Kateen. I have a couple additional points of view. As a developer, I've built over 25 homes in my district over the last several years. Half of these homes have tested higher than acceptable levels of arsenic in the water and required installation of water treatment systems. It was my priority to deliver a home that was safe to the buyers and their families, so of course I installed even under the sink system that cost about $350, or a full house system costing several $1,000s. We may hear testimony of what we already know, that for new home construction and for the sale of existing homes, the banks require home inspections that include water testing so that the problem in these cases gets addressed. I think the real estate industry does a great job as a facilitator in this area. However, I can tell you without reservation that there are hundreds of folks in central Maine that know they have water quality problems but do not test due to financial concerns relating to the cost of the test or system installation. I think 1162 goes a long ways to addressing this. My second point is that recently a research team studied 272 children and found that kids with arsenic in their water had an IQ score of 5 to 6 points lower than other school children. All of these children most of these children happen to live in my district. My district is what is known as a hot spot for arsenic. We need to raise awareness and get more people to test their water. I think 1162 is a step in the right direction for the state of Maine, especially for these hot spots like the one I represent. I urge you to support this legislation. Thank you.
All right. Thank you for the thank you, Representative. Any questions for Representative Hilliard? Seeing no questions. All right. Thank you very much. Are there any additional legislative co-sponsors who wish to speak to this bill? Seeing none, we'll now open up the public hearing for testimony in favor of this bill. Any individuals here to speak in favor? See if we can bring the podium down, bring the microphone down to your level. Thank you for being here.
You want to sign it, but I'll do it later. I'll grab it. This is testimony and a review.
honorable chairs, member of the committee. I want to first apologize. I thought I was going to the Natural Resources Committee because that's usually where I testify, so I have the wrong committee name on it, so I apologize for that. My name is Dr. Deborah Rice. I live in Woolwich, and I'm speaking on behalf of the Environmental Health Strategy Center. Maybe I'll just move a little bit. So I appreciate the opportunity to present a summary of the neuropsychological effects of arsenic in well water, which was what I was asked to do. As you've heard, arsenic is a known human carcinogen and is also linked to type 2 diabetes and impairment in cardiovascular function. There is mounting evidence linking environmental exposure to arsenic and deficits in neuropsychological function, particularly as a consequence of developmental exposure. In most of these studies, exposure was due to elevated levels of arsenic in well water. Studies in countries with concentration of well water arsenic higher than those that are typically observed in Maine documented links between arsenic exposure and intellectual deficits. The most commonly assessed outcome was IQ, with deficits documented in numerous studies. Additional specific effects observed included deficits in short-term memory, vocabulary, visual spatial ability, processing speed, and attention, as well as poor motor performance. Arsenic exposure was also linked to increased scores for ADHD and oppositional behavior. Some studies reported an association between poor performance and well water arsenic levels more relevant to those allowable levels in the U.S. of 10 micrograms per liter. A study in Bangladesh by a team of U.S. investigators documented impaired intellectual function in children with well water arsenic levels between 5.5 and 50 compared to children with well water levels less than 5.5. In this study, the median arsenic level was 10 by design, so that is the allowable level. Of critical importance is the study that you just heard about of potential risk posed by elevated arsenic levels in a study in Maine by the same internationally renowned team of investigators. They found that children with water arsenic concentrations between 5 and 10, so that's below the allowable level, had IQs on average 6 points lower than children with water arsenic levels below 5. Water arsenic levels greater than 10 were linked to further IQ decrements. Arsenic in well water is also associated with effects in adults. A study in Texas reported poor performance on a number of tests of cognitive function in older adults. The range was 3 to 15 micrograms per liter. And another study in the same Texas town, tests of global cognitive functioning were also found to be impacted. Consistent with results from epidemiological findings, studies in animals found deficits in learning and memory following either developmental or adult exposure, as well as impairment in motor function. Additionally, mechanistic studies documented multiple neurochemical and neuropathological changes. So that says that the epidemiological data are probably real because there's animal data and mechanistic data to support it. In conclusion, there is significant evidence that exposure to arsenic in well water results in deficits in intellectual impairment in children, and some evidence for similar effects in adults. Deficits were observed at or below the allowable level of 10 micrograms per liter in some studies, including a study in Maine children. These results suggest that levels of arsenic in some wells in Maine represent a health risk. And I know I'm out of time. If I could just make a personal comment, is that okay? I mean, it's a professional, personal comment.
Well, we're out of time, but I'll ask you, could you briefly, as the first question to be asked, could you briefly share this personal comment with us?
Yes, okay. When the state gets water, when results are sent from the state lab, which does not all of the well water testing in Maine, but a lot of the well water testing, probably the majority of it, it's the CDC's phone number that is on that piece of paper that they get back. And I worked for the CDC for 9 years, and I got a bulk of those well water calls because people would call about health effects, not only for arsenic, but for other contaminants as well. But they would also want to know about treatment systems and, you know, whatever, and financial issues. So they would call me about everything. And I have to say that there were numerous times over the years when people would call and say that either their landlord wouldn't do the testing, or if they did do the testing, they wouldn't tell them what the results were, or if they had gone out and had the testing done themselves, their landlord refused to do anything about it. I also had people call me and say that they would really like to know, particularly people who were renting, that they would love to know what their well water test results were, but they didn't have the $70 to do the well water test. And that was very frustrating for me because I felt like I really couldn't help them, and I'm sure it was even more frustrating for the people on the other end of the phone. So these are issues that are real in Maine. They're very relevant and issues that hopefully this committee and the legislature will be able to address. Thank you.
Representative Malaby?
Thank you, Dr. Rose. Were there any other variables about which there was maybe multicollinearity with arsenic presence and decreased IQ?
In these studies?
Yes.
Some of them were very well covariate controlled. There were, in some cases, multiple exposures. I mean, people would control for lead, but sometimes they also had to control for manganese. The well-controlled studies also did really good covariate control for mother's IQ, education, socioeconomic status. Bangladesh, it turns out that TV watching was an important covariate, for example, the number of hours that a child watched TV.
Inverse?
Well, no, actually, because it was a surrogate for socioeconomic status, because nutrition in some of these studies was also relevant. The study in Maine was done by a team of investigators at Columbia who were really world-renowned investigators. And that study, I can assure you, was very well covariate controlled.
And this may not be appropriate, but what does it take what's the process to remediate arsenic in water?
Well, as I think has already been mentioned, you can do it under the sink. It depends on the arsenic level in the well. You can do it under the sink, which will give you, your cooking and so forth and so on. And it's about $350. We actually used to recommend against, and I'll just go on a little bit of a limb here, against whole house treatment systems because they're not terribly reliable, they're really expensive. And when I would talk to people, I would say, do you have older people in the home? Do you have young children in the home? Maybe you want to do an under-the-sink treatment in your kitchen, but also do one in your bathroom. If you have really, really high levels of arsenic, you have to be sure that your toddler isn't drinking the bath water. So, I mean, I would spend sometimes a considerable amount of time, talking to these folks, depending on what their, the specific risks were in their particular household. And that's not only true for arsenic, but it's true for some of the other contaminants as well.
I have I know there's some question for Representative Head, but I have a quick question.
Okay.
Now, I'm reading some of the testimony from the department, and I'm not sure if you know this piece of the bill or not, but it says that their testimony says that it requires a landlord of a dwelling that is rented for human habitation and for which the water supply is private drinking water. Well, they shall disclose to each tenant of the dwelling the results of a water test conducted within the previous 3 years. So I don't know if you know these details of the bill or if that's better for someone else. So it sounds to me like if you have a new tenant in, you would have to have had done testing of the well within the last 3 years. And
I can't really speak to the,
Okay, well, that aside, and if I'm misunderstanding that, someone can correct that for me. I guess from your expertise, once you test groundwater, how likely is that, if you get a clean bill of health on the groundwater, how likely is that, how quickly can that change?
It can change, it could be stable for 20 years, but what happens is that the arsenic is coming from streams, water going through bedrock, which may contain arsenic or radon or whatever.
Okay.
And those streams can change. They can, from year to year, I mean, you could do an arsenic test this month, and the stream bed flow could change next month. And so that's why we say that, you should get it done. I think the recommendation is every 3 to 5 years. So then at least, you haven't been drinking contaminated water for the last 20 years. And that's kind of the best you can do. But those underground streams do change. And, looking at the data over the years is sometimes somebody would have a perfectly good well water test 1 year, and they would test 3 years later, and something would be out of compliance. So that does happen.
Okay. All right, thank you. Representative Head?
Do you know the ratio to dug wells as opposed to drilled wells, what the is there a number higher in one than the other?
Drilled wells are higher.
Drilled wells are higher?
Yeah, because
they go
dug
through that
wells
ledge.
are very shallow, and they,
Sure.
you know, they don't go down, and they're not gonna typically go through ledge, because if you
Right.
hit ledge, you're, like you dug the well
So
someplace else.
is there a test result stating that we could look at?
Which are which? It's not on the form.
Which has the highest level? Does the dug well have the higher level, or does the drilled well have the higher level? Is there a documentation for that?
Not that, I don't know, I think maybe Andy Smith might know, or people at DEP might know the answer to that question. There are very few people on dug wells, I think, except maybe up in the county. Almost everybody that I talked to had a drilled well.
Really? A lot of people in our area have dug wells.
Oh, really?
And the thing about it is that the springs that they're drawing from are right surface
They're
level.
surface, yeah.
As opposed to going through the ledge. But a bank will not lend money to buy a house unless you have a drilled well.
That's right.
So
My sister ran into that.
Very contradictory.
Yeah, my sister ran into that.
Yes, it just doesn't make sense to me. But I'd like to see some written documentation, if somebody could bring that, to look at the both of them.
Yeah, unfortunately, the form that you fill out for, for DEP or these private, companies, I don't think that there's a box asking whether it's a dug or a drilled well. That would be really interesting information to have.
Yes, it certainly would, because you just said that the drilled wells go through the ledge, and that's where the problem lies, is in that sediment that comes from the ledge.
Yeah.
Thank you.
Additional questions? Seeing no additional questions, thank you very much.